Okay, great. Thanks. Next slide. Okay, let's talk open enrollment 2025. No different than last year. The period is from November 1st through January 15th. Here's some numbers. 60% increase year over year. I mean, we've almost got 500,000 in Ohio now in the ACA, and a huge number of folks are still facing Medicaid redetermination. Um, that's there's quite a few. We expect, I would think more than 10%, maybe like 20%. So maybe adding another 20,000 to 50,000 in the marketplace due to Medicaid redetermination, and a huge opportunity for everybody. Next slide. Okay. And we're advancing. Great. Now let's talk about the certification. Nothing new to most folks. The links are embedded in this slide here, which everybody will get. Everybody will get a copy of this slide in the slide deck. You're going to click there to certify or recertify. This drives you to the marketplace. And one thing to remember is can't do anything about it, but you're going to have to reset your password every 90 days. That's just the new rules. Next slide.
So there I go talking. I don't want anybody to hear this. You're going to get a much smaller version of this slide deck. It's only about 80 megs big, so that will be impossible to send. But I think with the link that we send out, you'll be able to just go directly to the YouTube channel.
Hey, Brad. You can stay off mute. That echo's gone, so you can just stay live. Okay.
Thank you. That helps me a ton.
Yeah, that echo's gone. That really helped. So a quick shout out for the Help on Demand service the marketplace has. Again, that link is in this slide, and it's a way you can get free referrals from the marketplace. And this has been very, very beneficial to a lot of brokers, particularly if you're new to the industry and just starting out, trying to build your pipeline. The feds will give you live referrals, and you've got a period of time where you have to act on them. I think it's like half an hour, but they come over to you, and generally these have been pretty darn good leads, and they're fresh. So great service. Next slide. Okay, I want to point out the enhanced subsidies that have made these plans so generous. In the post-COVID era, they're going to be extended through next year. So beyond that, I don't know, but they're here to stay for at least another year. So next slide. I think we lost Brad.
No, I'm here.
Okay.
Sorry, I
Okay.
had to the shades. Take
Okay.
care of that.
And go back to my public service announcement. Just a couple more
Public
items here
service
about the
announcement.
consent form. Can you go back to the consent form?
This is the FPL, which we didn't talk about yet. Sorry.
Oh, okay. Let's talk about the federal poverty level. This is another grid you can keep on your bulletin board, on your wall, etc. This is, the new thresholds determining what incomes generate, what percentage of the FPL. And of course, we all know the lower the FPL, the more you get in subsidy. Okay, so the key figure here for Ohio, not every state, but for Ohio, is 138. That's the threshold where the subsidy begins in Ohio. But we do have other callers from other states out here. And some of them, like in Florida, they start at 100. So public service announcement now about the FFM consent form. We are all well aware that we have to keep one of these on file. And they're requiring assisters, that's you, your agents, assisters, brokers, what have you, to obtain the authorization for gaining access to their personal information, PII. And really, that's the first half of that form. And then the second half is their attestation to the accuracy of the form. And you need to do this in two stages. You need to, ask the consent part at the beginning of the enrollment, and then the review at the end of the enrollment. Okay, that's how they want it. I do want to point out, not only can you do it in a paper format like this, you can also do it in a recorded format and even like in a text format, but they require you to keep this on file. Okay, this is for their, their follow-up. If enforcement or something, a dispute comes up, you've got a record that you are in fact the agent of record um, on this. So next slide.
Yeah, and Geoff, let me just add.
Okay.
So everybody was worried about the two parts, sort of the consent and the review. Oh, I've got to get two different engagements to get one and then the other. So it's all now condensed. And if you like to keep paper or you would rather send an email with a fillable PDF, we have this. This is something we created or a marketing person created because she's better than Geoff and I. We'll send this as a follow-up document, so that way you'll have it. If you want paper or a digital copy, it's fillable. You send it to them, they fill it out, they send it back to you, but you have to tell them to remember to save it because it'll be blank. So anyway, that's just experience talking.
Next slide. Great. Thank you. Okay, my favorite part. I insisted on this slide. Okay, combating bad actors, and I'm not talking about bad reality TV actors. It's not. I'm not talking about Pauly Shore here. If anybody got that reference, I'm talking about the bad actors out there. Who
Or
are
not you.
stealing. Not me. Okay.
No, no, not them, Geoff. They're all good
and
actors.
and,
That's why they're
and
listening to this
not
training.
our agents either. We're talking about there's some agents stealing clients out there. It's somewhere to the tune of 100,000, couple 100,000, nobody knows, but there's been quite a few enrollments done without knowledge of the enrollee, of the client. So just some fake stuff going on in the dark web, that kind of thing, has been plaguing the marketplace over the last couple of years. So the marketplace is really cracking down on this, and they've implemented a system change to block this problem, which is called NPN switching. So it happened in July, and it happened just kind of at unbeknownst to everyone, including me. And essentially, um, what they're saying is it's a system that blocks an agent or broker from making changes to a consumer's FFM enrollment unless the agent is already associated with the consumer's enrollment. So think about that. You're going to be blocked, unless you're already associated with that enrollment. Uh, so to make changes to a consumer's enrollment, and let me read this to you so we're all clear on this. To make changes in an agent or broker who is not already associated with the consumer's enrollment is now required to either conduct a three-way call with the consumer in the marketplace or direct the consumer to submit the changes themselves. So yeah, that's the new
A lot.
rule. I can't do anything about that. I have begged and pleaded with anybody that cared to listen, and so have many, many other brokers. But unfortunately, if we're working on an old case, we have to engage the marketplace. And so far, it's gone pretty smoothly. And I'm here to help. Brad's here to help. We can get through this. Brad, any comments? You're shaking your
Well,
head.
Geoff, did you talk? I was just messing with you.
Yeah.
Thanks, Professor Geoff. Um, Geoff, did you forget that last line down there that says or via and approved? I didn't hear that part.
Or if you had approved a classic, um,
Direct enrollment or EDE. So you can do
right,
this on Health Sherpa, right?
right, but it's still with
Or
Sherpa, they're still asking you to do a three-way call.
okay, there you go.
They're still
That's
making
why
you do
Geoff
a
sits
three-way
on the
call.
calls every week with Health Sherpa and CMS, and I
Yeah,
do not, because he's a bureaucrat and I'm the
yeah,
farthest from
they're
it.
still making you do it.
Come on, Geoff, click and clack, have fun.
Yeah, okay.
There you go.
That's the dynamic, guys. We're the dynamic duo. So we're having fun with this. I get to talk about Health Sherpa. It's the country's largest ACA enrollment platform, and you all know it well and love it for the most part. You guys are using it. There's some other enrollment platforms out here. This is the one that I'm using the most. It has a very seamless process into healthcare.gov. Um, there is multi-factor authentication. It's automated. You'll love it. Call me. Let's get you set up on that. You can track your client base. You can do some analytics. You can add links from Health Sherpa into maybe an email or a social media post, and you can um, have your clients click on that link and enroll themselves. So it's a great, seamless, easy way to do it. I want to point out, though, Oscar notably is not using this platform this year. This decision they made, but beyond my control. And Oscar, for their part, is going to be using their platform. So, any questions, just give us a call.
Well, and gang, the reason they did it is we all think that it's free because it's free for us brokers to use, right? But it's not free for the carriers. I've heard reports from some of our other carrier friends that they're spending about $20 million a year. Now, they're some of the larger ones, but that's what it cost. And Oscar just felt that it wasn't worth it. And I think Oscar is making a large shift um, to ICRA, which is off exchange. So they built an enrollment platform primarily for their ICRA, and so they said, well, if we're building it for that, let's build it for on exchange. So that's kind of the reason. Um, so hopefully this won't be a trend. We've talked to some of the other large national marketplace plans, and it's just too big, and they're too big with enrollments to leave it unless Health Sherpa raises their price again. I guess I don't know. So enough of that. Geoff, just a placeholder.
Okay, so I got a comment that the audience is the audience is getting some feedback. So let's go back to muting ourselves. Okay, if you'll mute yourself, and I'm gonna. Oh, great. So Judy, is this any better for you? Just text me back if you wouldn't mind. Okay. Hey, let's talk about the ancillary in marketplace options. Okay, marketplace. These are our featured carriers at Cornerstone. We've got Aetna, Ambetter, Antidote, Anthem, CareSource, Molina, Oscar, and United Healthcare. And then let's talk about ancillary and supplemental benefits. That includes dental plans with Allstate, Anthem, Emeritus, Cigna, Delta Dental, and Humana. We still have short-term out there, and I want to point out short-term is limited to just 3 months with an option for a 1 month addition on the end of that. So in effect, you can only do short-term for 4 months with any given carrier. So it makes it somewhat problematic to do short-term. And certainly, have any questions about the new short-term laws, give us a call. Thanks. Back to Brad.
Yeah, and I'm just going to go on for a quick second and say for those of you joining us who aren't contracted with us at all or who may not have all of the carriers on this list. So the marketplace went live, well, sort of a demo period for brokers to get acclimated to it. Um, and so I don't know what you saw, and maybe your feedback will show us to see if there were any interesting things kind of now appearing at the top of the list. If you don't have some of those things appearing at the top of your quoting list, let us know. We can still add it at any time. Like Antidote, they're the new player for this year. So that one you haven't seen before. Some of you are familiar with it from Off Exchange. So any of these that you don't have, please let us know. Humana Dental, we've been seeing a lot of brokers picking up Humana Dental and Cigna Dental, both very good large national products. So if you don't have them, please just let us know that you want it. Emeritus is our largest, I think it's actually our largest written product of all products as a single benefit. So really exciting. As you are all in Medicare, you know it's all about dental. And so this might be a good way so you could use these for over 65 as well. So really benefits on some of those plans. All right. So I think, Geoff, go ahead. This is still you.
Great. We're still getting a terrible echo, even with each of us going back and forth. So I'm gonna kill my camera and see if that helps. And if you wouldn't mind responding in the questions, those that are affected, if you wouldn't mind telling me if this helps. So how do I turn off my camera? Okay. Sorry. Now we're down to just one bald guy on screen. So Sheila, did that help? Okay. Um, that helped
So
a
after
lot.
I do the next slide, Geoff, I know why it is. So after the next slide, it'll be fine.
Oh, okay.
It's that
All
thing.
right.
Shh, don't say
So,
anything.
hey, we talk about this every day when I'm talking to new agents and folks getting in the industry. This is a great market for early retirees. Okay, so early retirees bridging the gap to Medicare. Often they find themselves in the need of individual health insurance. You guys do a fantastic job. I can't tell you how proud we are of our agents and brokers. And not only are we proud of you, our carriers are proud of you. They say nothing but good things. Um, they credit their success to the agent and broker community out there driving business. The majority of what's sold is through brokers. So keep at it. These are the target markets. In addition to early retirees, college grads, millennials, new state residents. Okay. And next slide. Hopefully you can hear me. Okay. Brad, take it
Yes.
away.
Yeah, I can. Hang on a second. I just have to flip over for a quick second. And then after this, we'll make a switch on audio and you'll be able to hear a little bit better. And I wanted to get pumped up this morning, so I thought I would. Ready for this. Okay, you get the idea, so I'm gonna stop this. So, as many of you know, I used to be in the fashion business, and I don't know, all of the meetings that we did were very exciting. So, I tried to bring it a little bit. And now, let me go back to the original scheduled program. And, Geoff, after this, we should be able to have no feedback. It was really about splitting off the media audio. Now, if I can only find my screen, here we go. That wasn't the right one. All right. I think we're back now. I'm going to come on camera to just see if we're fully functioning here. So, talking about what you're all here for, the ACA market footprint. And so, when Geoff and I created this last week, we really wanted to give you, because I know it's hard to join every one of our carrier weekly calls for the last 2 months. So we wanted to try and condense and give you the most information in a very compact form, so that you'll have what you need for starting this Friday. So again, if you want more detail, you can always go back to the Cornerstone website and go to the Resource Center and webinar series, and you're going to see every one of the 1 hour videos that Geoff and I do with a carrier rep. So those are all housed there. If you need a little bit more detail, I would just say that probably the first 15 minutes are carrier fluff. So I would always start at about 15 minutes in, because nobody wants to hear all that. So, what's going on for the market here in Ohio, Kentucky, Michigan, Indiana, states that we have brokers? So, I'm not going to read every number to you, but you can see, like Aetna, for instance, is going to be taking a very large hit. It's a great carrier. They have nice plans, but 17% might not be too sustainable. Antidote is new, as I mentioned earlier. Ambetter in Ohio and Indiana is actually taking a reduction. So that should put them in a pretty good place, and a negligible increase in Kentucky. Anthem, kind of the standard for Anthem, usually 7%. A reduction in Indiana. CareSource, this is a toughie because the CareSource plans look very good, but a 10% increase, I'm going to tell you that you have to weigh that increase. Maybe with a CSR, it wouldn't be so bad, but you have to weigh the premium with the benefits. As I always say, do the math. It's all in the math. When you run the numbers, you should get there. Molina, you're going to see a lot of expansion from Molina. And look at this, except for Michigan, I'm just going to call them flat at less than a half a point increase. Oscar in that standard kind of 7, 8 range. Oscar Columbus, different from Northeast Ohio, about 5%, and United Healthcare at 6.56. And then, not to be left out, I wanted to give you an idea. These are all the carriers that we do not have in Ohio with AltCare, Medical Mutual, Summa, and Paramount. We're not a GA for them. And this other grouping are all in Michigan. So if you have your phones out, take a picture of this. I'm not going to spend much time on it. Um, so yeah, so there you go. Thanks. Okay, so plagiarism is the best form of flattery. So we were on, and I don't know if any of you, I think I see a few names that were, but CareSource does a presentation. They did it every day last week in different states, and Ohio was on Thursday. And so this is a really good profile when you're looking at it. And so one caveat here, these premiums are, it's based on a 21-year-old, I'm guessing, male, but they're putting on this, and they may not always be the lowest price, but they're just saying that in Cincinnati, Ambetter is going to be the lowest premium. CareSource is actually going to be the highest at $120. In Columbus, Oscar's going to be the lowest cost silver, whereby again, CareSource is showing up at $101 premium or increase over the standard. In Cleveland, it looks like Molina is going to be the lowest cost silver plan. This is all before CSR. This is just standard rate. And who's looking high here? It looks like it's Oscar, if you can believe that. You have a premium network, you get a premium price. Akron. This was actually something that was added last week. They added an extra slide, but Ambetter is looking like the lowest in Akron, and the highest being Oscar at 172. Imagine that. And then our friends in Toledo, Northwest Ohio, Molina looks to be the lowest price cost silver. And then you could see some of the others. It looks like Paramount is about 63. I can't even read 83. So that kind of gives you a little bit of a roadmap. Again, I'm going to leave it up for a second, take a picture of it if you want to observe it until we can get out these documents for you within the next 2 days. Geoff, it's all you.
Thanks. Thanks. Thanks, Brad. Can you hear me? Okay, fantastic. All right, let's talk about Aetna. Aetna, leading off with Aetna, commission $20 PM. We pay that commission, and they're huge with CVS. It's a partnership with CVS, so they have access for the CVS Minute Clinic program. That's kind of like oh, what do we call that here? Little
Urgent care.
Clinic is another we've got something like that with Kroger, but Aetna uses the CVS Minute Clinic, okay, for needs like urgent care and things like that. $25 per quarter over the counter at CVS RX, and they also have zero or low cost generic RXs. And there you see the network, very strong in Cleveland. They've got the University Hospital, Rainbow Babies, Southwest Metro, and more. And in Cincinnati, they have the Mercy system. In Columbus, they've got Ohio Health, very strong system up there, along with Licking Memorial and more. So next slide. I want to point out that Aetna is adding some counties. Okay, let's discuss that. I think in the next slide.
Here you are. Sorry,
Okay.
lost my mouth.
All right. So they're making a big splash, entering 15 counties. Allen County, obviously Lima. That's a very large market. So glad to see them moving into Western Ohio. And what's more, they're um, making some pushes into sort of the north central parts of Ohio. They're getting out over towards Richland, towards Cleveland. So they're making a nice push into adding some markets into Ohio. Uh, Reemphasize the Minute Clinic, 1,000 locations inside CVS Pharmacy and Target. I love my Target. So you can go into Target and access the Minute Clinic um, and get some benefits through Aetna, some added benefits through Aetna. So talk about the dental. It's embedded. It's $1,000 annual max. The vision, it's also embedded. It's 150 um, with material allowances. Okay, so look for the vision and dental listed on the title of the actual Aetna plan. New members, uh, their ID gives them a 20% discount on CVS health brand products and a $100 OTC allowance at CVS. Next slide.
Yeah, and that was annual, by the way. And Geoff, we're about a half an hour in, so
Okay,
we got to pick up the pace a little bit.
gotcha. Thank you. Okay, and better. One of our key partners as well. Commissions $20 PM in both Ohio and Kentucky, and they're adding a couple of counties here. Um, Again, Brad alluded to it earlier. They're dropping. They're the only carrier who's dropping their premium for 2025, so we anticipate them gaining a lot of market share, and they do a great job. University Health in Cleveland, and down here in Cincinnati, they've got the TriHealth, Mercy, and UC systems. Um, in Columbus, they have Ohio State, which includes the James Center, which is very highly sought after. Um, and Toledo, they've got Mercy and the
UT.
University of Toledo. Next slide.
Well, what about Dayton? They have Kettering, so I just said it.
Dayton, they've got Kettering. Sorry, I didn't mean to leave out the Gem City. Okay, the folks in the Gem
Exactly.
City
There
love
you go.
you. Okay, right in my
Yeah.
backyard. They're in Michigan as well. Um, there we are in Michigan. We're looking to add more agents serving Michigan. They do a great job in the Southwest, or I'm sorry, Southeast Michigan, and also over in the Grand Rapids area. Next slide.
Those are pretty much the two main towns in Michigan, and then once you
But
get
I love my
above, like,
Traverse City. I wish they were in Traverse City.
what
That's
I'm
one of my
saying,
favorite
there's more
places.
trees than people above Interstate 94. Just FYI.
Okay.
Okay.
Love the Wolverine State. We do love the Wolverine State. And we love the Buckeye State. We love all states. Okay. And let's talk about the Bluegrass State. Ambetter making a huge push into Kentucky. Again, very competitive with pricing down there. They've added a few counties here in central Kentucky. In the Louisville area, they've got U of L and Norton. Up here, well, in northern Kentucky, which is my backyard, They have St. E's, which is really the only hospital system in Northern Kentucky. That's the three
Is that a
counties.
Mercy Health system?
No, mm-mm,
It's not. It's
no,
separate.
they're
Interesting.
independent. They are
Okay.
independent.
Very neat.
Mhm.
Okay.
They're independent,
And our
well known,
Hoosiers?
well sought after. And the Hoosier State, I know it. I love it well. They're statewide. They have IU, the Hoosiers, and Eskenazi. Um, Eskenazi is a system in central Indiana. There's more, obviously more throughout Indiana. And talk to me if you have any questions about the Indiana presence in places like Fort Wayne and up in Lake County and places like that. So next slide.
Jeff, are you a Hoosier or are you a
I am a diehard IU fan, and they're doing so well in football right now.
but didn't you go
So
to Ball State?
no, I didn't go to Ball State.
I was just messing with you. I
I
knew
know
that.
you were. You see,
Yeah.
that's the back and forth that that's the um, value
What we
add that
deal
we
with
bring
every day.
every day. So talk about the highlights, guys. They're using the Premier network now. So it used to be called oh Core,
Core.
but
Just
now it's
core.
even better. It's called Premier. Key ingredient with Ambetter, unlike the other carriers, which are HMOs, Ambetter is actually an EPO, which allows you to cross state lines and have in-network service. This is huge for folks like you going to Florida and you want to find an in-network hospital. Yes, Ambetter has them. So just mention to them down in Florida, you've got Ambetter Centene, you use the Premier network, um, and see you being an Ohio Ambetter client can access a lot of hospital systems in Florida, in Georgia, in whatever 25 other Ambetter states there are. They're very aggressive in that aspect. There's also Ambetter perks through their partner called Abenity. So huge discounts on products and services. They've got adult and vision buy-ups on many plans, $1,000 of dental coverage. It's a good little dental product, and the adult vision plan and is $130 per frame. Am I talking too fast, Brad?
No, you're good. Just
Okay,
keep that pace. You're
keep
good.
going, keep going. We'll get through this, guys. They've got a really robust network offering, as I mentioned earlier. So very solid uh, marketing, very solid um, product offering with Ambetter. Next slide.
And everybody, I just want to say again, you have to when you're talking about. I think it's like the once you get it's like Missouri and below. There's really nothing north in the plains and in the Big Sky country. It's all east and down below. But just convey this message. It is not open access to your clients, right? They have to go on, do the provider search, and make sure that the provider they want to see in that other state, Arizona, South Carolina, Texas, Florida, it's where everybody wants to go in the winter. Just make sure that, because Florida is one of those states, gangs, in my past experience, uses multiple networks. Okay. So just be cautious of that. Please convey it. You don't want a claim on your E&O because you told them something. We all know that they don't hear. They hear what they want to hear, not what you tell them. So just make sure you're being emphatic on that point if you're going to write "and" better.
Great.
Wow,
And
nice
Jennifer,
segue. I think this is me.
yeah, let me
Go
let
ahead.
me qualify one thing before we
Yeah.
go to antidote and you. But Jennifer Kaufman brought up a really good point. Did they Ambetter drop Christ? And I'm going to look into that for you. We don't have the ability to add every hospital system on these slides. And as memory serves me, they did have Christ in the past. So let me verify if they've got them in 2025. My belief is they probably do, but I will
And
follow
you're
up
going
with
to
you
see
and everybody
something coming
else
up a
on that.
little bit later. You're going to see something, and it might be in there, but I'm going to look
Okay. All
in the
right.
meantime.
All
Okay.
right, Brad.
All
Take it
right.
away.
My turn. Thanks, Jeff. Please interject whenever you want. So, Antidote Health. I've been working with Antidote probably since last May, Jeff and I, but more specifically me because the network is richer in Northeast Ohio. They were off exchange for 2024. They kind of came late to the game in 23, and they didn't get the approval from CMS, but they did this year. So they're paying a $20 per member per month, up to 5 members in the household. They've now expanded out to a total of 43 counties. You're seeing those there in the orange. So in Cincinnati, they have the Mercy system, not tremendously good, but I hear Mercy in Cincinnati is maybe better than it is here up north. They've got Mount Carmel, they've got OSU, which also means the James Cancer Center, as Geoff mentioned, and they have Nationwide Children's. Really great. Everybody, is there only one hospital system in Dayton, Geoff? Kettering? I think there is. Here in Northeast Ohio, um, there's Akron Children's, Metro Health, something called CCS. I don't really quite know what that abbreviation is for because we're not really allowed to say it. It's just 3 letters together that have some other meaning. And Mercy. Toledo is also Mercy. And in Southeast Ohio, they use the Genesis Health system via Lease Network. So this whole section of the country, or state rather, is all predicated on Genesis Health, which is out of Zanesville. Which is in Muskingum County, if I'm not mistaken. So this is anecdote, highlight, or overview. Now, let me tell
Got to
you
break
about,
in, Brad. Just a
yes,
quick
please do.
qualification on that slide. And
Yes.
again, Gem City, Dayton, we love you. Yes, there are more than 2 systems in Dayton, and thank you
No
for
way.
clarifying that.
Yeah,
Um, but Antidote's just got Kettering. There's also what's called Premier or Miami Valley.
there you
So,
go.
and we've
Thank
got some
you.
carriers coming up that have that Miami Valley Premier
I'm
system.
like a New Yorker. There's nothing west of Lorain County like there isn't west of the Hudson. Sorry. It's a reference from anybody from the East Coast. So back to Antidote. Um, it's a virtual first model, right? So for the greatest savings, your members are going, or your clients are going to need to go on the Antidote Health app via their phone, their computer, whatever digital media they have. Um, your clients, if they wanted to pay the highest copay, they can go directly to the bricks and mortar provider, but if they start with virtual, it's about a 15-minute wait. I think they ask questions to kind of qualify. Then you go on with a live, either American or Israeli doctor. So overnight, they utilize an Israeli provider group, who are also part of the owners of the company. So you'll always be speaking to somebody not in the Pacific Rim, which most of you have a hard time. I have a hard time. So um, virtual care is zero. If the virtual care provider refers you to a tier one provider, it's also zero. You can get virtually referred um, also for zero. Sorry, that was the same thing. And discounted copays will apply if you start virtually when you're referred to a specialist. So they changed the names for those of you who sold off exchange for 2024. They're now called Complete and Complete Plus Dental. And it basically utilizes a zero copay core RX. So we have highlights available, but I would say, gang, we recorded Antidote probably early, which was late August. So just go out to the website or our, resource center, and you can grab it there. I think it'll look really good. It'll all make more sense when you can see the whole slide deck if you want to understand it better. And then they have the next set of plans, which is Elite and Elite Plus Dental, which has a zero advanced RX. So it has even more than the core RX and zero cost virtually referred labs. So why would you pay for labs if you can make a 15-minute call and get them referred? PT, OT, and speech therapy, physical therapy, occupational therapy, and speech therapy has a low copay as well. They have diabetes and hypertensive chronic condition benefits, so zero on select insulins and related supplies, test strips, lancets, glucometers, that kind of thing. and hypertensive medicines at zero as well. Discounted referrals to specialists, custom treatment plans after the assessment for those suffering with those two high cost um, high cost of care that drives most of healthcare. Diabetes is probably the number one by a landslide. Um, Adult dental buy-up, so it's 100% preventive, 50% co-insurance for basic and major service, and you have $1,000 max. I can't remember what network they use, but I will get back to you in the questions because I have it written down here someplace. So I wanted to show this slide because it's a little bit different way to update the network, find the network. I have this web link. I found it was easier, but when you get to Quality Care Partners, QCP, because there you can see Genesis. It's all related. They own Ohio PPO Connect, which happens a lot in the self-funded market, in the group market. But you click on Antidote. Now you're on the segment of the network that's dedicated to Antidote. And if you look over here, you see an example of what a search in Cleveland will yield. So this is just a random picture, FYI. So I don't know, read into it whatever you will. Um, Anthem, I guess I'm doing Anthem too. So Anthem didn't have a ton of changes over 2024. Their commission is $8 per member per month, max two. So husband, wife, or parent, child is the only thing that will pay there. So their network, Christ System in Cincinnati, TriHealth UC, that's a pretty robust network. In Cincinnati, Cleveland, it's just Metro and St. Vincent. And St. Vincent is pretty much outpatient. It's no longer acute care hospital. Columbus, they've got Mount Carmel and the very large Ohio Health. There's Kettering and Premier. That's the one I forgot. And in Toledo, they have the very desirable ProMedica and also Mercy. They're in all 88 counties, barring none. So they have a robust network. I think, in all honesty, Northeast Ohio is kind of where they're the weakest. So we have a lot of things sold in Central Ohio for Anthem. And in Kentucky, they have whole state in Kentucky as well. Commission here is $25 per member per month. I got to believe, Geoff, and correct me if I'm wrong, it's still the same uh, two member policies. And you could see that they're using that St. Elizabeth's in Northern Kentucky, the Norton system, and the University of Louisville. And in Lexington, they're using University of Kentucky and Baptist. And sorry, it's a tricky mouse. In Indiana for Anthem, they're in all counties except for those 5 counties that are close to Cincinnati. So they use Geoff's IU Health, a health system called Clarion, and there's a few others. There's not much data available in southeast Indiana, so Evansville, Paducah, across the other side of the river. So you'll be able to look, guys, you can all go on your broker portal and find out the network that you're
Yeah.
looking for.
And if I could interject, so
Yeah, please.
Cincinnati bleeds into southeastern Indiana a little bit, and unfortunately, Anthem doesn't have a lot of coverage in places like Dearborn County. But certainly consult us if you run into one of those cases.
Got it. Cool. I don't remember what a 2025 engagement package is. Geoff, do you remember that? We wrote it, and
It's
I
in,
don't remember it.
it's not unlike the other
Blah blah blahs.
incentive programs
Okay,
that
maybe that's
the
supposed to be $100.
wellness programs,
Wellness.
that sort of thing. Hmm.
Geoff's the king of wellness. I am not.
Yes.
Members can receive up to $100 in incentives for their wellness activities. That probably includes making an appointment with your primary care, um, going online, as well as doing the health assessment. Those are probably the 3 things that earn your clients their incentive. Anthem Dental is one of the largest PPO networks in the nation. It is a separate plan. We just kind of put that in there. And then they also like to talk a ton. We just had the Anthem on our WebEx last week, and they talked a lot about Sydney as if a digital app was so revolutionary. but Nancy and Kathy think it's just amazing. So we're going to say it's amazing as well. Um, they have special silver plan focuses on heart patients' needs. So held hearthy. So gang, you're starting to see from all of these carriers, they're really trying to manage chronic conditions, right? Hypertension as well as diabetes, although they don't specifically call out diabetes. Um, Care Source. Am I doing Care Source, Geoff? I think I am. Yes.
Yes, you are.
Care Source. Okay. So the thing I did earlier was brought to you by Care Source. Thank you very much, Tony Cato and the rest of the team. So plagiarism again, not a bad thing. Just don't do it in college. My son, who's not listening, be straight laced. Anyway, commission is $21 per member per month. They have a very, very strong network in Ohio. They offer two children's hospitals, and they added Athens. No, I thought they took Athens away. Geoff, I thought
Oh,
they got,
that's a typo.
yeah,
They don't
that's
have
a, yeah.
Athens.
So
Yeah, they
Knox
don't have
and
Athens.
Athens, they're in
The map
86 of
is
88
accurate.
counties. Yeah,
Yeah,
okay. There you go. Good.
sorry about
Um,
that.
let's see. We've got University of Cincinnati, Children's, Christ, TriHealth, and Mercy. I think that's all five hospital systems. Did we leave anybody out,
Yeah,
Jeff?
they've got everything in Cincinnati. They have
Wow,
everything.
finally,
They have
finally
everything in
somebody.
Dayton. Look
They
at
have
the
everything
Gem
in
City.
Dayton, the Gem
Let's give them
City.
a shout out.
Yeah. So
Kettering
is
and Miami Valley, the premier
there you go.
system.
Cleveland, University Hospitals, Lake. And Lake is a part of University Hospitals, but because it has its own notoriety, I like to keep it separate because there's a lot of questions for some carriers whether they have Lake or not. So we also have Metro Health, Rainbow Babies and Children's, which is a UH product, as you know. There's OSU, James Cancer Center, Nationwide Children's, Toledo, ProMedica, and Mercy again. So Toledo just doesn't have UT in their network. And there's CareSource in Kentucky. So purple are all this counties that we're in, a lot in northern. It looks like kind of northern Lexington, Louisville to the west, and then kind of down
Yeah,
that
they've actually
I-75
pulled out of
corridor.
several counties. It used to be pretty
Yeah,
much filled in.
yeah,
So
yeah,
not as
yeah.
strong in Kentucky as we'd like them to be, but still
But they're
a huge partner down there.
and listen, Kentucky's not an easy state because it is
Hmm.
a state-based marketplace.
Hmm.
Geoff, tell them what you know about that state-based marketplace that's changing for
Thank you, Brad.
2025. You're welcome.
Into my
See,
next
I
public
think
service
about other
announcement.
things.
Okay. They use the Connect system. That's KYNECT. It's their own platform. Um, there's a link on the state website, starting with Kentucky Online Gateway. They do some background, and then they send you the training. And talk to me if you want to be FFM, or sorry, if you want to be Connect certified. Talk to me if you want to be Connect certified. The training's not too different than the FFM. The platform they have is standalone. You can't use Health Sherpa to enroll a Connect client. You have to use their platform, similar to some other state-based marketplaces. There has been a reputation that it being slow and methodical, and they claim that they have
Arduous.
remedied that, and it's much better this year. And we hope to see a big uptick in enrollments in Kentucky.
Perfect. So improvements, right, Geoff?
Improvements.
Most, what was the percentage of broker sales in Kentucky, Geoff? Do you remember that number? It was much lower than it is in Ohio.
Oh boy.
Pretty much because of that
um,
platform. But
it's
it's
for example, Northern Kentucky. I would expect to see like close to 50,000 ACA enrollees. They have, I believe, fewer than 20,000, 20 or 30,000. So there's room for improvement in Kentucky for sure. But I don't recall that
so
statistic.
yeah. If you're looking
Yeah.
to expand, now is the time. The only thing is,
Uh,
with all state-based marketplaces, like Geoff mentioned, you have to do their own certification. For those of you doing multiple states, you're kind of like doing like our owner Ryan Carroll. does every time somebody wants to contract in another state. It's not that easy because he has to do all the same things so that you can do all of those same things. So just FYI, if it's going to be really important, a lot of members, we can do it. CareSource Indiana, the entire state. They use IU as well. In Southeast Indiana, they use St. Elizabeth's and Cincinnati Christ. So that is CareSource Indiana. I don't know why it's not talking. Geoff, is IU all over the entire state
Yeah,
in terms of
it's
hospital
like
systems?
many other states, there's like a category killer. In Pennsylvania, they have UPMC. In Indiana, IU has just dominated that state, particularly like central Indiana. There's a different system up in Fort Wayne, and I can't remember. I think it's called Parkview. It's a big system up there. Somebody up there might correct me, but by and large, the Hoosier State is dominated by IU Health.
Good. Everybody loves their Hoosiers. And
Yeah.
so for Michigan, CareSource is entering Michigan, and they're doing it by way of a co-brand with the Health Alliance Partner, or HAP as it's commonly known, and it's in the 5 counties that you see in kind of pink down there at the bottom, which is basically Metro Detroit up to Troy. So it's serving Wayne, Macomb, Oakland, Genesee, Lapeer, and Siawassee counties. And so
Nice
the few,
pronunciation.
not
I had a
bad, right?
side
I've been
bet you were going to blow
practicing
that.
all week. No, you thought so. Never doubt me. Because I used to travel to Michigan. So there you go. How about that?
All
So
right.
using Ascension hospital system, the Corewell system, as well as the Henry Ford system. So those are three large systems in Metro Detroit. There are some others that are pretty big, but they have their own plans. So um, if how do I want to say this? For people in Michigan who are contracted with HAP, CareSource is already going to be in their network. For those of you who are contracted with CareSource through us, you're going to be able to sell it in Michigan as well. You're not going to have to worry about getting contracted with HAP. That's just a great FYI. So this is a good thing for those of you in Northwest Ohio. You a little business, just head north. What are the things I want to talk to you? And guys, having like reviewed these all, and I never like to show favoritism towards any carriers. There's a lot of great carriers we have. We're very, very lucky in Ohio, as you know. But their plans have pediatric dental on all plans, zero first exam, zero retinal imaging, zero first pair of glasses for ped dental and vision. They're introducing a new platinum plan, right? So we've got gold at the highest. Well, I guess platinum is going to be like Oprah level, but it's probably not going to get written so much. It's probably Tony, our rep, kind of joked around. The premium might be like $3,000, but somebody who can afford it, they get that. So I don't know that it's going to be too well used, but they're just throwing spaghetti at the wall to see what sticks. One of the things that I like most about their plans in 2024, they had this diabetic silver plan and also a gold plan. And it was so successful that they added a heart healthy silver and gold plans. So you don't have to be a diabetic or you don't have to be hypertensive to be on these plans, but they're their formulary skews towards both of those conditions. So you're going to want to check the whole formulary. It's got some really nice copays, especially if there's any kind of at least mid-level cost share reduction. You're going to want to think about that. So, Geoff, I'm kind of bullish on CareSource this year. Geoff
Right.
didn't used to be bullish on CareSource. Now he's equally as
Oh,
bullish.
stop it. We're
All
just,
right, so they have
I was
they
just,
have some. Go ahead.
I was just very cautious.
You're very cautious.
That's my nature. That's my nature.
It is. Thank you,
Right.
Professor. Appreciate it. Um, they have a high deductible health plan. It's called Preventive Silver. It is HSA qualified. Their only HSA plan. They use Teladoc for their virtual care at zero. If any of you know that Teladoc was really the first real and large virtual care model. Probably about 15 years ago when I started in the industry, Teladoc was just cutting their teeth. So it's always good. Now, this is something that they touted as a pretty good deal. So somewhere, depending upon your service area, it's a $3 to $4 extra to add adult vision from iMed, which gives you a $250 frame allowance or contact lenses, and it gives your clients access to fitness via the activeandfit.com. How what do you call those, gym network. So very good, a nice ad. Again, remember how I said, gang, that sometimes you have to weigh that premium for what you get. I think you get a lot on these plans. Um, so just an overview. This is going to be intensely hard to read. I just wanted to put it out there to show you what you get on the diabetes plans. You get screenings and tests at zero copay. You get zero durable medical equipment. So glucometers, a CGM, continuous glucose monitor, as well as pens, needles, syringes, all of that stuff all comes available, and zero drugs. So look at the list of insulins that they have, and they're the very common ones at zero: Humulin, Novolin, Humulin R, Novolin, Humulin 7030, Novolin. Those are the two largest, biggest, most used um, insulins there are. Then it has rapid acting like Humulog. It doesn't have Novolog, but just Lispro, as well as insulin. I think it's a Spart is what they call it. But you can see the list. I'm not going to read you the whole list. It's kind of monotonous. And then for heart, it's zero tests and screenings. So they're going to do a zero cost lipid panel as well as a metabolic panel, EKG. So you can see how this is skewing. It's really good. And you could see some of the most commonly taken hypertensive medications out there. But check out the second line: Jardiance, Farxiga, and Entresto at zero. Gang, if anybody is using any of those are some of the most expensive medications, and CareSource is giving them for zero. There's some durable medical equipment, blood pressure cuff and monitor, and compression socks. For any of you that play sports, you could also use them to jog so you don't get shin splints. That high deductible health plan, Silver, is HSA eligible. And again, you could see everything that it gives you. You're going to get this slide deck. I'm not going to go into it more, but you could see some of the meds. So just take a look at this when we send it out. We're not going to send you all of these slides. We're going to send you the most important, probably just the carriers. Geoff, I think it's finally your turn again.
Thanks, Brad. Before we
Whew,
go to Molina, to answer Jennifer's question, on my smartphone, I pulled up Ambetter, and they do have Christ in Cincinnati. So thanks for pointing that out, Jennifer. They
there
do
you
have
go.
Christ for 2025. I'm sorry I didn't add that to the slide. Let's talk about Molina, another key partner of Cornerstone's over the years. They have increased their commission to $20 per member per month, which is
From
huge.
16, 25% increase.
Huge. Yeah, they're really digging in this year. They're going after it. They just had a modest increase in their premium, so I don't anticipate, you know, a huge increase for our clients and whatnot. So we want a lot of retention there if we can. And they've added some counties. Um, they are
Lots.
stronger down here in Southwest Ohio and in Central Ohio. Down here in Cincinnati, they've got Mercy and UC. UC has really come on as one of the preferred hospital networks in Southwest Ohio. Their cancer center is nationally ranked, and they're on the verge of being deemed one of the national cancer centers, similar to the James. So, a shout out to UC Medical and all the improvements and um, you know notoriety that they have so well deserved. So in Cleveland, they've got the Lake and Metro system. Okay,
And
Brad
guys, this
alluded
is a
to.
highlight. There are more, right? This is just
Yes,
a highlight. We didn't adapt
yes,
this, but I'm going to show you something a little bit,
yeah,
give you the full on, the whole Megillah, as they say.
the whole Megillah. Okay. Columbus, they're partnering with OSU, and of course that means the James Center. In Dayton, they've got the Kettering system. In Lima, they've got the Memorial system, and there is much more to that. 88 counties in Ohio, they're probably in about 75 of them. So next slide.
Oops, sorry.
Okay. And this is the Bluegrass State. So they're adding some counties here, and you can see them
Okay.
there. Um, I don't know the name of that county in southwestern Kentucky. They've added there. It's too small, but
I think
suffice
that's
to
like
say they're very
Paducah,
strong in
Kentucky area.
central and the Louisville area. In Louisville, they've got Norton and U of L. We wish they'd come up here to northern Ohio or northern Kentucky. Forgive me, northern Kentucky, which is that little panhandle thing right at the very top of Kentucky that borders Cincinnati. Next slide.
Yeah, and when we talked to
Oh,
their head of
yeah,
sales, he was telling us they were going to do this massive expansion in Kentucky, and the sum total
5 counties.
is 5 counties. So
Yeah, five
maybe some
counties.
things changed. Yeah,
Yeah, Henderson
I
is a good
think that
addition.
is Boyd County. What
Yeah,
it's looking like
Boyd.
over on the
It's
left.
yeah, I can see the bullets at the top. Boyd, Greenup,
Okay,
Henderson, Lincoln, and
Michigan.
Rockcastle. Okay, the Wolverine State. Okay, again, solid in southeastern Michigan and over in western Michigan. Um, they've got most of the important networks, not all of them. And the next slide. Solid commission too, 24 p.m. And then we'll go to the next slide and talk about a few things. So the big takeaways for me, go back if you wouldn't mind.
We're talking about this. Okay.
Molina, there you go. The big takeaways is they've increased the commission 25% in Ohio. Okay, 25% in Ohio, that's huge. They're on par with all the other carriers now. They've added 15 counties in Ohio, making a total of 78 counties where they have a presence. They have Mercer County over by the Indiana border, and that's a key enrollment state for us, and a nice, solid, productive region for many things, including insurance sales. And like we mentioned, they've got 5 new counties in Kentucky, and they've got the 15 in Michigan. Members can earn $200 in rewards by creating a login, doing the wellness assessment, and the annual physical. So that's a very generous incentive bonus they've got. They've got an RX savings solution to maximize someone's RX benefits. Of course, they have Teladoc. All the carriers use some kind of telemedicine. They use Teladoc, and they've also got an adult vision offered by VSP. That's a very, very generous vision program. It's $150 per frame. Okay, that's the highlights for Molina. By all means,
Hey, and Jeff, can I just add?
fire away.
Um, so there's one other thing that we forgot to add here. They are so the commission, and this next thing I want to talk to you. I made a very big deal about when we were in Miami at their agency roundtable. I said you've got to pay the agents more, and two, you have to offer bronze plans. And so bronze plans are going to be added. So I don't know, Jeff. I would say we're kind of bullish on Molina too, just
Right, I
because of
failed to
those
mention
additions.
bronze. They've added
Like
bronze. That's a good call out, Brad.
right,
They added bronze in
right. And so
Ohio. That's
yeah,
huge.
yeah. Yeah, and that discussion was, well, we've never had luck with bronze. And I kind of told him a story from my old days. And I said, I was going to open up a big and tall men's store because I'm kind of a big guy. And I had one of my customers who owned a men's store. He said, Brad, why would you limit your chances by selling only 10% of the business? So do the other, but just specialize in big and tall. So it's the same thing. That's how I pitched bronze to them, and they're doing it. And I wasn't the only one. There were other agencies that felt the same way too. But do me a favor so I look good and I get invited back to Miami again in February. Please sell a little bit of Molina for Brad. Maybe it'll take you too, Geoff. I don't
Thanks, Brad. I don't know how to take that.
know.
Okay.
Well, you went to all the others. That's the only one I could do last year or this year.
Oh, I love
Oddly
you like a
enough,
brother. Let me
Miami.
tell you that.
I know.
Okay, so let's talk about Oscar. And Oscar has been a key partner with us over the years, and they're unique. They are very tech heavy. They have their own full stack integrated enrollment platform and broker service platform, hioscar.com, and they're very integrated with all things electronic and new software, new technology, partially owned by Google. So that's a little background with Oscar. What they like to do is partner with just some key medical networks in a given metro area. So as a result, they're not in, the majority of counties in Ohio. They're basically in Cincinnati, Columbus, and Cleveland, but they've added some counties, so good for them. And kind of filling in the I-71 corridor. They've got $18 per member per month, commission paid direct to you, and they've added, one county over here in southwestern Ohio. I think that's Clinton County.
Yes.
And what's more, they've got the Cleveland Clinic. That's their flagship network. Okay. The Cleveland Clinic is, like I say, a category killer in Northeast Ohio. I was really, really taken aback. They have so many practitioners up there. We were looking at a stat last week, weren't we, Brad? The number of practitioners the Cleveland Clinic's got.
17,000 or something like that,
Yeah, it was
or
just
1,700.
I was I was stunned. I didn't. That
That
was
might
that was
include Florida. That might include
okay.
Florida.
Yeah,
Is my guess.
I don't recall it being 17,000 in Ohio alone, but it was
1,700
very
then.
significant. So they're very strong with the Cleveland Clinic. Keep in mind that they're siloed. Each plan is siloed a little bit differently. So the Northeast Ohio program has the Cleveland Clinic, but the Northeast Ohio folks, they can't use like the Mount Carmel as
UH.
in network, right? They kind of just you're kind of just siloed in your area. So in Columbus, for example, you've got Mount Carmel and Nationwide, but you can't really access the Cleveland Clinic. Okay, that was a little different
Yeah.
a couple of years ago, but you'd have to realize that they're very regionalized in that sense.
But
Um,
that's why you saw in Northeast Ohio, what was it, an 8 to 10% increase, and in Central and Southwest Ohio, it was like a 4% increase.
mhm,
So Cleveland Clinic is also an owner of Oscar too.
mhm.
So that's what you're paying for. And gang, if you didn't know, I'm sure many of you do because you've quoted. It's usually the highest premium without cost share reduction when you're doing quoting on whatever platform. So it
Okay,
doesn't come cheap, at least in Northeast Ohio.
okay,
Keep
all
moving because
right.
I don't
Run
want to
out of
go
time.
over.
Yeah, we want to get to the questions.
Yep. There's a lot I see.
Okay. 5 new counties for Oscar: Clinton, Vinton, Mora, Holmes, and Carroll. Okay. They've got $0 virtual urgent care. Okay. And that's a thing. I've known people to use virtual urgent care, so don't laugh. Okay. It's not like they're going to ask you to do an amputation or something like that at home. That would be terrible. But there is a need for virtual urgent care. In many cases, it's very beneficial for sprains and bruises and aches and pains and stuff that you just need immediate attention. And obviously, if it's super important, they will send you to a brick and mortar location right away. So virtual urgent care is one of the benefits, and then
Yep.
most commonly prescribed meds are available for as little as $3. I'm sorry, I'm rushing through this, but
That's Russian.
Yeah, that's rushing. Let's go to the next
So I
slide.
just want to, I just want to, I
Oh, go
just want to
ahead.
say before we go away, these 5 counties they're adding are relatively rural counties. So when you talk about Holmes County, you're talking about essentially Sugar Creek and Dover, New Philadelphia area. And I had a debate with our rep. I said, what hospitals do you have in this area? Because there's a hospital called Pomerane, which is in Holmes County. They don't have it. And I don't know in Clinton and Vinton and Morrow, Geoff, but in Holmes and Carroll County, somebody's going to have to drive to Canton to get to a hospital.
Mm-hmm.
Yes, in an emergency, they take you to the closest one, but they will
Mm-hmm.
probably, if somebody's going to go inpatient, transport you. That's an added cost. So it's
Mm-hmm.
really going to be for outpatient care. Just
Mm-hmm.
wanted to give full disclosure. I'm not besmirching Oscar. I just don't want anybody to get an E&O claim so just public service announcement from Brad.
Thank you.
And somehow
Thank you.
Geoff wanted me to do United Healthcare. Why? I don't know. Um, and Geoff, they're not paying $25 PMPM. I think they reduced it down to 20. I thought we changed
Right.
this slide. They've
Yeah.
got 100. That's $20. $20. We're going to send you a whole commission list of all the carriers' commissions in 3 states.
Mm-hmm.
They've got a $100 reward debit card again, doing those things, a health assessment, scheduling a visit, getting the mobile app. So a year-round 20% discount at Walgreens on Walgreens branded OTC items. Those members who sign up are going to get a complimentary AARP membership, which is really just a funnel for Medicare, right? So they have that list. And did you know kids as low as 13 or 15 years old can actually be an AARP member? Because we did a test, and at the time I tested my son just to see if it worked, and it would work. And it was more of a joke also. Um, Dude, you're getting an AARP magazine. Why is that? So anyway, their expansion was. This is again. Why did we do this? They are the same, probably because they're the same. There is no expansion for United Healthcare. You're going to see kind of along the Ohio Turnpike and Interstate 90, kind of across the north, and then it goes down. I don't know, kind of 75-ish, Route 30 down to Cincinnati area, and you could see the hospitals. I'm not going to read them to you. They're also in Michigan, pretty much Grand Rapids and 3 counties. They're using Corwell and
Detroit Medical.
DMC,
Yeah.
Detroit Metro Center. So I think United Healthcare. I think they have a nice premium plan, nice um, nice benefits, but their network is kind of lacking, guys. They're using Mercy Health throughout the state of Ohio as their prime network. Then you see Dayton, but in Columbus is probably where they're the strongest, and Cincinnati. So they have Mount Carmel and the COPC network of providers. So and UT as well in Toledo. So if you're in those areas, pretty much along the I-75 corridor, it probably makes more sense. Or if you're in Youngstown, there's 2 hospital systems in Youngstown, one being Mercy, the other being something else. So that is Youngstown. And for those of you from Youngstown, I just couldn't remember its name, so don't yell at me. So some of the highlights. So right here are some of those things. It's the same 40 counties. There is cross-border coverage for those of you Toledans in Monroe County. Network remains the same. As I said, there are no referrals required to see a specialist. However, if that specialist is going to do a service, they probably need to get a prior authorization, which is kind of standard. They have their copay focus plans, which is their top seller. So instead of having a high deductible, it has a lower deductible and mostly copays. Their bronze plans, Molina, I sent him this, 45% of their sales. So bronze is important because there's a lot of healthy people out there that don't need an expensive plan. They don't want catastrophic, but they want something a little bit better. Virtual first plans are sunsetting in 2025. So United Healthcare, maybe didn't see the success with virtual as they did. But Geoff, didn't they add? What were the two? You didn't like one of their virtuals, and that's the one they're getting rid of. But I believe they still have
What was that called?
a
A
virtual. There's kind of a
Galileo.
name.
Galileo.
Galileo. Yeah, they got rid of Galileo, which
Yeah.
was this, and they're adding something else back. And
Mm.
sorry, I can't remember the name. Refer to the Resource Center webinar series, and you'll hear it all there from our
Just call
friend
us.
Mitch. Huh?
They can call us,
They can
right?
call us, and we'll find out. Sorry. Um, it's a Monday. We never do these things on a Monday, so we're a little
We
off.
should.
Uh, but we wanted to get it for you before you started your week. Diabetes enhancements, diabetes management, zero copay for 8 visits, and zero on formulary insulin. So again, on formulary, not all. My guess is it's Humulin and Humulog and Novolin, probably not. So the fast acting like Humulog and Novolog, a doctor told me those are the quick hitters. So they don't, they're not often on formulary because you have to take them a few times a day, and it gets expensive when you have to do that, as opposed to the acting. Just some of the stuff I learned along the way. And there's $150 in health perks. They do have a fitness buy-up program for those that are of your clients who are interested in fitness. It's called One Pass Select, aka it's like Renew Active. 4 network options. That you have to pick the options you want there. There's 12,000 to 18,000 locations, depending on which one of the groups. So say maybe Planet Fitness and the YMCA is in one category, and then Anytime Fitness and LA Fitness are in another category. So all year long, they're going to get your clients are going to get a 20% discount on OTC at Walgreens, unlimited, just on Walgreens branded product. Is this me or you, Geoff? I think this is you. Whew.
You can
I was
take a
trying to go
knee.
fast. It's hard for. Yeah, I'm going to take a knee.
Yeah, we're gonna just breeze through these next few slides. We've got a referral program. It's called Autopilot, and it's through the um, ARC Benefit Solutions. That's our referral team. They work on referrals that agents provide them. Um, they, work at your behest. So you send us what you can't, you know, um, put on your plate, and we'll help you out. We're in other states, so many states that you can't serve, like maybe Florida or Georgia, Indiana. We've got those states, and you can send us those referrals. And by the same token, if you're maxed out in Ohio, we can certainly take referrals for
Some of
Ohio
your
as well.
overflow.
And you get a piece of the
Well,
action. We share
caveat.
the commission.
Yeah.
Go
The
ahead.
caveat is, Geoff, right? Um, so, like any referral, last minute is not advised. And so, from our team that's from the client service unit, don't expect on December 13th you're going to send us 30 leads, because they're probably not going to get worked any
Mhm.
easier than you were able to them. So just be conscientious that it's the busy season for our internal sales team. Again, they're not competitors. It was created because there were a whole lot of group brokers out there who wanted nothing to do with Medicare or the ACA. Or after the 2013, 2014 season, there weren't a whole lot of carriers in the ACA. And so a lot of you said, you know what, I'm going to take a pause. Brad pretty much took a pause up until about last year from ACA, but here, and it's getting better. The subsidies really mean a lot. So there you go, Geoff. That
Oh,
was
thank you.
already that. We talked about
Thank
that.
you. Okay. And I alluded to this earlier. This is the agency services program. And it's, like I mentioned, Autopilot, the referral program. There's also other programs involved in there, including succession planning. So maybe you're just trying to get out of the business altogether, and travel Europe or do whatever, and you want an easy exit ramp. Talk to us about that. Succession planning, and then a kindred program called Flight Plan Retirement Assistance. So these are other ways that we can help you. as you navigate your retirement or your exit strategy. Call us if you have any questions. Next slide.
Copy. So
Okay.
I'm just going to
And
slide
I
through
alluded to
these.
this earlier.
Oh,
So skip that slide. Another
you said skip
shout out
ICRA?
for
No.
AGB. Fire away. You had a question?
No, you wanted to talk about ICRA. Sorry, my
Oh,
mouse
I
is
just
pretty speedy.
just mentioned earlier AGB. Um, the previous slide, that's our internal CRM for agents. You can access your
Where did
book
it
of
go?
business and commissions, and it's a link to it on our
You can
website.
too.
There you are. And so this is your one-stop shop to manage your book of business through Cornerstone. So we have um, access. You can get to your book of business through this. It's 24 hours a day. Send us an email and we can grant you access if you already don't have that. Okay, lots of material on AGB. So
Okay, keep moving.
okay, ICRA. ICRA, what is an ICRA? So I'm talking about this a lot. Brad's talking about it a lot. We've got an in-house specialist, Lael Reitler, who is also working on this. This is essentially selling individual plans in a group setting. They call this the individual coverage health reimbursement arrangement. It was rolled out in the last year of the Trump administration, and it's a type of health reimbursement arrangement that allows employers to provide tax-free reimbursements for employees' individual health insurance premiums and other qualified expenses. Okay, so it's a federally sanctioned, federally approved, federally constructed method for you to sell individual plans in group settings, and essentially, as an employer, they would grant the employees a stipend, and it's usually on a sliding scale depending on age, because as you get older, you got to pay more in premium. And then the employee would also submit a portion of that premium. Unfortunately, it's not eligible for an FFM subsidy, so they're going to have to, cover the cost of the insurance premium with the employer contribution and the employee contribution. It is really popular. Why? Because in many cases, this is the only way an employer can offer a health insurance plan, because otherwise they wouldn't meet participation requirements, or we're just finding group plans, group quotes are just so high. The individual products are much less. And so we've seen a threefold increase in ICRA over the past 2 or 3 years. And you've seen the ads for the different ICRA platforms. We've got several that we like. And this is a conversation that we can have with you. It's not something we can just snap our finger and just say, okay, go out and start selling ICRA. We have to have a conversation with you. And so you're up to speed on it. Just give us a call. It's, I think, the wave of the future. And Brad and I are really diving into this in a big way, along with Lael. So uh,
Yeah,
hope to
and
hear
and
you.
just yeah, a couple of things too, Geoff. Right. So ICRA are sold off exchange. So it's not on exchange, because if it was on exchange, there would be a subsidy. So you can't get the employer reimbursement amount or contribution. You're giving up the subsidy in order to do that, right? What's that other thing, Geoff, where they could get the subsidy? What's that other thing
Oh,
that's not written very
Kushera.
much?
We're
Right.
not really promoting that too much.
No.
There's
It was
some
the first of this.
hoops. Yeah, it was the first iteration of that. There is something called Kushera. Um, it's not too well endorsed. There is something called Kushera. Again, call us. We can talk about it. Okay?
Yep, there you go. Okay,
That's
cool,
all
cool,
you got to
cool.
remember today is call us.
All right. So this is
Email
like
us.
really pass through slides. We're almost done. So
Yeah.
in your follow-up package, this is what Geoff and I have been working on in the last 2 or 3 weeks. I tried to get an early start on it about a month ago, but um, we created this grid. It's all 88 counties in Ohio by carrier, by county. And so as you see highlighted in red, those are the new expansion county, or the new expansion carriers for those particular counties. We're going to send this out to you. It's a really great document, as well as Why did I do it twice? Sorry about that. You're also, Geoff really likes the maps, so you can also get a map too. The only thing with the maps is it uses a lot of your ink when you're um,
Yeah,
so you
and
could have it
I do
digitally,
want to
keep it on your
apologize. I
laptop.
think the map for Anthem, Kentucky was kind of washed out. So we'll redo the Anthem, Kentucky app map. So yeah,
Yeah.
some of those
This
colors
happens to
were
be
washed out.
Molina, which looked familiar
I
from
know
before.
this Molina's,
And
yeah.
and and oh wait, where did it go?
Questions.
Darn. Answer a question while I pull
Okay.
something else up that I want to show everybody because it's what I've been spending the most time on. Um, Come on, where did it go? Let me stop sharing. I want to show you this because
Okay.
it's a masterpiece. We improved it over last year. Uh, um, Hello, I have something on my computer. Find it. Anyway, it is the network grid, which um, was just 3 or 4 pages in alphabetical, but this year I've regionalized it. So you have Northeast Ohio. So kind of think Interstate 70 dividing the state east to west. So that upper right quadrant. And then in central, there's like Columbus metro area down to the Ohio River. Then there's Northwest Ohio, probably Erie, Huron County, and west down just north of Dayton. So kind of think like and Ohio, Cincinnati, in those counties. So these are all going to be available. I just need to update that. I had to build the shell and then use the 2024 network. I still need back a few other carriers just to make sure that we're not missing anything. So that's what's coming. Geoff, start answering questions. Wait, there's one
Yeah,
more
and
really great slide that I thought was kind of
I
clever
certainly apologize
that I
for the
wanted to
audio
share.
quality. We're doing
Keep
everything we
talking.
can to mitigate the problems, but if I talk real slow, and Brad loves it when I talk real slow, I think everybody can hear me, so I'll talk real slow. Um,
Oh no,
Whitney's
shoot
comment,
me.
the grids are great. Thank you, Whitney. I want to talk about this. Jennifer asks, it's my understanding per Krista Seaton at CareSource that Monjero will also be offered at $0. Do you remember that, Brad? You're on mute. Sorry, you're on mute.
Um,
There you go.
how about now?
I
Can you
think
hear
so.
me
I think
now?
that was the case. I remember hearing that. I remember hearing
Yes,
that.
yes,
Yeah.
yes, it was.
Okay.
So I wanted to visualize the entire CareSource presentation, but Geoff wouldn't let me. So I found a way to do that in a limited way. So um, see, Geoff is just so upstanding. Um,
Okay.
Norton, yes, Ralphie
Okay.
boy.
I do want to
Thanks,
clarify
everybody. Geoff,
something.
finish the
And
question.
Jennifer also points out that Health Sherpa will redirect to connect. Okay, so factually accurate, absolutely. You can quote Kentucky plans on Health Sherpa. It's going to hand you off to Connect to do the enrollment, which is their platform, their methods. They're You're gonna ask a lot of questions, but I'm told that it's much better this year. So stay patient with Connect, and we want you selling on the Kentucky platform if you so choose. So, okay, we're going to give everybody a copy of the slides in a little bit pared down.
An
If
abbreviated
you
slide
need
deck.
a full PDF of this particular presentation, including the slide on the honeymooners, we'll include that as well. If you just reach out to me personally, I will make sure you get today's slide deck as well. But we're going to try to pare this down for
Just give
the
it a couple of days.
sake of saving some memory because there's so much in here. And we're pretty
Because
much
Jeff and I are
close to the
losing
end.
arms.
Any more questions?
Does anybody under 50, well, under 35 knew who these people were before or can give the names if you're under 35 what the two names of these gentlemen are in their characters?
We'll give you a gift card. I'll give you a
Swear.
Starbucks gift
Who's
card.
paying for that? Okay.
Yeah,
A
I got
Starbucks
my
gift
own
card?
resources.
I thought you loved Target for a free bag of popcorn.
Yeah, that's not a
It's too
healthy
salty. You're not
substance.
allowed to eat it anymore.
I'm not allowed to eat popcorn.
Just not
So,
salty. You can eat the bland, dry
okay.
stuff. So on the right is Ralph Cramden, and over here on the left, that's Norton. I don't know that Norton actually had a last name. I think Norton was his last name, right, Jeff?
Ed Norton. It
Ed
was Ed
Norton.
Norton.
Thank you. So
Okay.
Ralph and Norton.
So, yeah, just taking a few more minutes to see who else is out here. And
Thank you all for staying on. We
yeah,
only ran over by a little bit, but
yeah.
I didn't see anybody leaving, so we were trying to be engaging, provide as much information in a compact nature as possible. Um, what
I
else?
think we
What
did
else? You
it.
seeing anything? We did it?
Yes,
Yeah.
we did it.
Yeah, yes. Yay to all of you. Have I know you're already well into Medicare AEP, and now you can start layering in a little bit of ACA starting this Friday. So we wish you all good luck. Jeff, myself, and Carla are here for you when you need us, because that's services is in our company name. Cornerstone Broker Insurance Services Agency. That's us. That's Jeff. That's me. Say goodbye, Jeff.
We cherish your partnership. Bye,
We sure
everybody.
do. Thanks, everybody. Take care. Have a great rest of the week.